And
Mhm.
so, but that's our normal right now in our society for our teenagers.
Mhm.
But, you know, gently or, you know, breathing and sleep wise, snoring is very, I get this all the time. Well, yeah, I've always snored, but I feel fine. And I just want people to know that that's their normal, but that's not necessarily good. If you're snoring, you are not getting as much oxygen to your brain as you could be. And like I mentioned before, that can have long-term cognitive effects, heart health effects.
Welcome back, friends, to the Erie Wellness Podcast, where we explore a wide range of wellness topics, highlight the incredible local professionals right here in our community, and encourage you to advocate for your own health and well being. This week's episode is a part one of a part two series that we're doing featuring two sisters, Dr. Heather Stamm and Dr. Chrissy Stamm. Together, they're helping local families better understand the connection between airway health, sleep, breathing, jaw development, and overall wellness. So today I'm joined by Dr. Heather Stamm. After more than 20 years practicing dentistry, a personal health discovery changed the way she viewed the connection between breathing, sleep, jaw development, and overall health, and led her to pursue a deeper airway focused approach to dentistry. One of my favorite takeaways from our first discussion that we had was Dr. Heathers often says normal doesn't always mean healthy. So just because a symptom is common doesn't mean that it's something we should ignore. If you've ever felt tired despite getting enough sleep, wondering if your child's development could be impacted by the way they breathe, or simply want to better understand how airway influences our overall wellness, this conversation is for you. Welcome, Dr. Heather.
Hi, thank you so much for having me.
I'm really looking forward to our discussion today. But before we jump into airway focused dentistry in particular, I'd love for you to
Sure.
share with our audience about your personal story. I know there was a turning point for you during a sleep dentistry course where you realized that they were describing symptoms that you had been experiencing. So, can you share that with our listeners?
Yeah, I mean, for my story, I've actually almost been in dentistry 25 years now, so it's been a while. And with in general, I've always been passionate about learning as much as I possibly can for my own health, my family, but also for my patients. So
Mm-hmm.
I've taken many different continuing education courses over the years, and I was signed up to take a course from a world-renowned dentist who was focusing more on TMJ function or dysfunction, which I had already been practicing with.
Mm-hmm.
Um, and his class, they were now relating it to sleep. And I thought, well, that's interesting. I've not heard that before. We didn't learn any of this in dental school. So I think it was in like 2014. And so I'm sitting in the class and it basically just started. He was just listing symptoms, didn't say why he's listing symptoms or what to do about it or anything. And I just started crying. Um, and my husband's actually a dentist as well and was sitting next to me and he leaned over and he's like, oh my goodness, they're talking about you. I'm like, I know. And so
Mm-hmm.
I was obviously moved by what he was saying, but I knew whatever I was going to learn in that class was going to literally change my life. Thus, it changed how I look at patients, how I treated patients from that point on.
Mm-hmm.
Um, Symptoms I literally was going through right at that point in time. You know, I've always been a type A, like, you know, high, go, go, go person. So stress is just my normal thing.
Mm-hmm.
And I had younger kids, age, I think 4 and 7 at the time, you know, so you're like in it as a mom. And I was just definitely fatigued and I had related it to stress and all that. And I've always been a light sleeper, what you would coin as a light sleeper. And I was just sleeping even less.
Mm-hmm.
I would wake up in the middle of the night and I couldn't fall asleep. And there were times I would even go into the office at like 2 a.m. because I knew I was not going back to sleep. So I might as well get stuff done. So
might as well work.
yeah, I mean, obviously that is not healthy long term to sustain. So I was, very tired all the time and just kind of in a fog, so to speak. And health wise, I'd just been diagnosed with hypothyroidism. My thyroid was so bad that my hair was actually falling out. So I was already on the search of like, what the heck is going on? And that was what one of the things he was listing as a symptom was the hypothyroid. And he listed things of what happens when they're people are younger and what they go through, and a lot of things he mentioned, grinding, TMJ pain. I sucked my thumb. That was something else. So like it was just crazy. He was just describing me. So I realized I need to get on this because I also learned the importance, and obviously my health was already being affected quite drastically with my hair falling out. I mean, I got to an extreme symptom, if that makes sense, but I didn't realize no one that I had seen had put that together with poor sleep. So my journey to amazing sleep, which I do have now, wasn't necessarily easy or fast. It maybe took about 4 years to fully do it. But what's great is within that 4 years, I basically did everything, tried everything. So I know what everything, all that's out there for people, and I know what it's like. I you I did the basics like use blackout blinds in your room and sleep masks and take melatonin and things that I could do right then. Even like I wear blue block glasses at night, to filter out the yucky lights. So I did that very early on, and then I tried different like mouth appliances that help move your jaw forward and open up your airway back here. And I did have a sleep study to actually get a diagnosis, and I did have a diagnosis of apnea. And I did do blood work. That was my like first time with blood work, just to really to start helping regulate my hormones because that plays a role in yucky sleep. And so I was on those journeys. And I just still wasn't getting good sleep. I was still waking up quite a bit. So then I went and tried what's called a CPAP trial, where they let you like test out. I think I tested 5 different CPAPs of trying to see like if one would work because there's all different kinds out there. None of them worked. And then I went and got nose surgery to help open up my nasal passages right here as much as possible. I had trauma in high school. I was hit in the face with a softball, so it caused like collapse in one side. So I did definitely get some benefits from that, but I still knew it wasn't optimal or enough. And I ended up figuring out that my jaws were just too small from growth and development for any of these treatments to work. So I actually got jaw surgery, which I was an extreme case. Most people do not need jaw surgery to get good sleep. But after I had jaw surgery, I sleep great. I realized I had never even knew what a good night's sleep was. Like, can't remember ever because I had never, experienced it. And after the jaw surgery, I experience it now all the time. So I well worth it. And I don't think it was a waste of time for me to try anything else because you never really want to jump right to surgery. And it gave me the opportunity to go through that whole world and understand for my patients, have empathy in it, know what everything's about. And I also know more of what to look for, of if someone is more likely to need surgery, if that makes sense. So, yeah,
Absolutely.
I was patient 0. And then, I mean, it just made me see patients differently, treat patients differently. So it helped, it changed my life of that aspect as well.
Well, sleep is certainly important, and
Yes.
if I'm sure there's a lot of listeners who you're talking and they're like, "That's me," and we start
Yeah.
to give excuses like, "Oh, well, I'm just
Right.
in the thick of it right now," or,
Right.
"I have young kids," all these things, or my hormones are changing, but it's important to kind of just explore what's right for you and what's going on and how you can help, because sleep is so important for our day to day. Um,
Yes.
but so for anyone who's never heard of the term airway focused dentistry, what does that actually mean and how is it different than traditional dentistry?
Yeah. So, I mean, airway focused dentistry basically is looking at how the mouth, the tongue, the jaws, your facial development affects your breathing and your sleep. So, like
Mhm,
quite simply, traditional dentistry is historically just looking at the teeth and the gums. We're looking for cavities, gum health, maybe how your bite is aligning, cosmetic work, which all matter, are important,
mhm,
but an airway focused dentistry just takes a step back and asks the question, is this person well
mhm,
overall? The mouth
mhm.
is the gateway to our overall health. And so it just starts in that position.
Okay. What are
Yeah.
some of the tests or like evaluations that you do when it comes to
Yeah, I
airway health?
mean, we definitely do a very thorough health history, very thorough dental history. We
Mhm,
do sleep screen everyone, which the American Dental Association has highly recommended since 2017. So not every dentist is doing that, but we've
mhm,
been doing that for a long time. And so just in that you get more of a patient's story, and anytime there's a yes on anything, we dive deeper.
mhm,
So that's like tests, so to speak, but I mean it also has to do with symptoms. I mean, like I mentioned earlier, everyone's different, and there are a lot of symptoms that can be tied to sleep or airway issues. There,
mhm,
with the screening, there is, an actual, if there's this many yeses, then this is how likely, they are. So if the tongue looks like this, if the back of the throat looks like this. So there are measurements that we do as well when looking
mhm.
into the mouth. I don't know if
Okay.
that helped answer that question.
Mhm. No, I was just, yeah, curious about kinda like what that overall assessment looks like and how it's a little bit different than just, like,
Yeah,
going to the dentist, so.
yeah, yeah. So thorough is the word. And I do have patients going, "Why are you checking all this?" And I'm like, "Yeah, well, it's the gateway, like I said." So, yeah.
Yeah. Well, I have a little bit of a personal connection. So
Oh,
all 3 of our children, had lip and tongue tie releases, and 2 of
mhm.
ours had to
Yes.
go through myofascial therapy before they would do it. But one of the things that our myofascial therapist had mentioned was hundreds of years ago, our diet looked different, our environment looked
Yes.
different, and
Yeah.
now we're kind of as a population as a whole, we're seeing smaller mouths and more airway related issues today. So what's happening there, and why has our modern lifestyle, diet, and
Yeah.
environment changed the way our jaws and our airways have developed compared to generations before us?
Yeah, I mean, this is quite fascinating, at least to me.
Mhm.
There has been a lot of research and studies for a long time, like you mentioned. And one more popular one is from Weston A. Price, who was an anthropologist and actually a dentist,
Mhm.
who followed different indigenous cultures all over the world. And he was really seeking, is there correlation between diet and dental health and diet and overall health?
Mhm.
So what he found was differences where they ate a lot more fibrous foods at early ages. They're breastfeeding, way of doing it was a little different than the more modern culture. And this was 1939. So this is the modern culture at the time. Their diet had little to no sugar in it. Their diet had no processed food whatsoever. And what he was finding was, again, he was a dentist, so he found that zero, maybe little, but really no decay in their mouths. All their teeth were straight and coming in and had room. And obviously, they didn't have any orthodontic care.
Right.
And that their overall health was like disease wise way lower than the modern civilization. So, and I think even now we probably eat even less fibrous foods than in 1939. I don't think normal or common is to give you your 2-year-old beef jerky, which might be something like that they were given. We give them, applesauce in a packet, and
Yeah.
those puffs as snacks that just disintegrate in their mouths. Like our jaws are literally not working. And bone to grow needs to be stimulated. So we're supposed to be stimulating our muscles. So, I mean, that's one thing he found related to our jaws are smaller because they're not stimulated. And another thing is in environmental. They didn't have environmental toxins like even in 1939 they were exposed to. And, we now have like more EMF stuff. There's different things that can affect our system in general. And he noticed that they were more nose breathers versus the more modern society was developing more mouth breathers. And that can come from the toxins. Our body just has to filter more. So there was more chronic allergies, problems breathing through the nose. And so if you can't breathe through the nose, it's hard to be a nose breather. So you just start to become a mouth breather. And that actually affects your tongue position, which affects how your jaws grow. Because your tongue should be up on the roof of your mouth. But if your mouth's open, that's impossible, basically. And that tongue is not stimulating the muscles and the bone either to grow how it should. So our body can, compensate in many ways, and that can be disease, which was finding, and it can be how the jaws are developing.
Well, Dr. Heather, you explained that so good. And I think that it really gives people an idea of what's changed? Why are things different? Why are we dealing with
Right,
this now
right,
versus, 100 years ago, people
right,
didn't have these issues.
right.
So, but yeah, it explained it so well. So thank you for giving that
Yeah,
little
yeah,
background.
yeah. Just
Um,
paraphrasing a big story. Yeah.
yeah. So, what are the symptoms that patients are coming into you with that may actually point back to airway or sleep issues?
Yeah, well, I mean, there's a broad list. Some are more obvious than others. Some obvious ones is if you're snoring or a bed partner, hears you snore or gasping for breath, or an actual diagnosis of sleep apnea. Jaw pain, people kind of are aware that something's off if they're having jaw pain, grinding their teeth. They're aware of things are off, but less kind of obvious ones would be chronic fatigue, anxiety, the stress of the life. Let's see, grinding, clenching, like I mentioned, dark circles under someone's eyes, having problems breathing through your nose, suffering from more chronic sinus issues,
Mhm.
waking up multiple times at night, waking up to have to use the bathroom. That's a big sign, even if it's just
Mhm.
once just during night. That's one of
Mhm.
those things where it may be common, but not necessarily good.
Mhm.
Yeah, so I mean, kids can look a little different and similar. They can also snore and grind, which is a big indication. They can have speech issues that might be related to a tongue tie. They can sound like they're breathing loud, being more of a mouth breather than nose breather. I mean, when they go in, they might find that their tonsils are big. They might have a lot of history of ear infections, bedwetting, night terrors. Um,
Mm-hmm.
I'm sure there's much more. I mean, hypothyroidism,
Yeah,
like ADHD, like symptoms. So
mhm.
definite with kids if they're having any issues in school, really fidgety, hard to stay still. So it's definitely the ADHD like symptoms.
Mhm. Someone comes in, they say, "Okay, I'm having these symptoms." You
Yeah.
do an evaluation, and then what happens?
Yeah. So I dive deeper. Like if someone says I'm not sleeping through the night or, chronic fatigue or there's reasons for that. Like if it is a mom, is it because they can't sleep or their partner's snoring or one of their kids can't sleep, obviously. So
Mhm.
like I said, any symptom, yes, we're going to dive deeper. And then we take that and we do an oral exam and see structurally if there's anything that could be contributing to that. We
Mhm.
do imaging that actually measures your airway. And there's different, numbers that we're supposed to be at ideally. So, but it starts with the patient's story and
Mhm.
goes from there.
When you say airway,
Yes.
like, how far deep does that go? Like,
Right.
what where does it end, that your airway?
Right. I mean, it is kind of all connected. So, I mean, when we take our imaging, it's like a three-dimensional X-ray that goes around your head, and it starts in the nose and just follows all the way down their sinuses, all the way down, your throat. So we can see all of this, and your mouth, obviously. So
Mhm.
it's all connected, and there could be just one part of it that's off that's causing an issue, or it can be multiple things.
Mhm.
So, yeah.
Okay. So I'm gonna plug in the listener question for this
Oh,
episode
okay.
here.
Okay.
So if one of my this came from a listener. If one of my kids has airway issues, should I probably be looking at the rest of the family too? So I guess the question might be like, is it a genetic thing? Is it common to see it in multiple people within one family?
Yeah, that's a good question. And yes, there is a genetic component to it. Just like most things, genetics aren't everything, but there's definitely more of a component to it. I see parents that have small mouths, and then it trickles down to their kiddos as well. And is it environment causing that or the genetics? I believe it's a combination, but yeah, absolutely. It does not hurt anything to get everyone screened.
Mhm.
Yeah.
Right. Other than sleep, what are some, like, other things that it's important to bring up? Like, your airway is important because, 1, you're gonna sleep better. Like, what are some of the other things that you like to talk to your patients about where they can,
Yeah. Well,
have
I
a
mean,
better quality of life?
absolutely. I mean, breathing slash oxygen is foundational to health. Like, without it, you can't first of all live, and with a decreased amount it mainly affects your cardiovascular health and your
Mhm.
cognitive health. So the bigger issues are tied to cardiovascular diseases, strokes,
Mm.
and
Mhm.
then cognitive wise, dementia and Alzheimer's. So like
Okay.
those are the big ones, and our body's really good at compensating. For a while, it's like I got this, and we see like the less obvious symptoms, like I said, but you're still able to function.
Mhm.
Maybe not optimally, but you're still able to go. But then it's more of what happens 10 years, 20 years down the road of that quality of life. And so just thinking oxygen is very important. Your body knows this, so it will do things in your sleep if you're not breathing properly to get that oxygen. That is sending a jolt of epinephrine and waking you up, making you grind or clench because it actually stimulates these muscles to open up your airway. However, it doesn't let you get to the deep levels of sleep. And the deeper levels of sleep is where our body repairs itself from all the damage that happened during the day, from all the toxic things, the free radicals that we were exposed to. Like it helps muscle repair, tissue repair, brain repair. And so if you're not getting to that deeper levels, all of that is not getting the repair. For kids, it's where growth happens. The growth hormones released in that. So there can be growth issues related to that. So I'm not sure if that makes sense, but
it sounds really important. Like it's like that is foundation, like you said, to life. So
yes. It's not just about sleep, it's about oxygen. Yeah.
So what are the common like treatment plans that you're prescribing to your patients? Like how do you get better airway?
There's many different ways to do it. So it definitely depends on what we're finding in there. But simply, if something in the mouth is not big enough, then you look at, is there a way to make things bigger? And we do things called expansion, where there's different actual appliances that kids and adults can wear to help expand their actual bones and jaws. And then we can move teeth around to also expand. If your teeth are tipped in like this, that takes room for your tongue, or your tongue just doesn't have enough room as it should. And so it's not able to go in the proper place to open up your airway. So if you upright your teeth, how they should be actually, and not collapsed in, that gives your tongue more space. So that's something that's fairly easy to do to absolutely give you some room, and that opens your airway. If you're tongue tied, you can have that released. That will also open up your airway. With the x-ray I take, I see where the jaw joint position is. If it's set backwards, the lower jaw here is forced backwards, that's closing all this airway. So there's ways to help your jaw relax forward. And there's different appliances treatment for that. So it all depends. Sometimes I see a beautiful airway right here. The mouth is actually wide, but they're still struggling. And when we do our imaging, we see that the nose is totally clogged up or deviated so much that it's completely blocking one side to breathe. So, I mean, I work with a lot of different healthcare providers out there. We work closely with ENTs, that maybe they need a nose surgery, allergists, if they're suffering from chronic allergies. I mean, it could be a change in diet, like I said, checking the hormone levels. If all of this structurally is okay, then we dive deeper into what else it could be. If it is your sleep habits in general, are they healthy? And I give all my patients a quick like sheet of healthy sleep habits and what that looks like. So I start with structure, because if that's not where it should be, you're absolutely can have struggle with breathing and sleeping. And if that looks good, then like I said, we dive deeper, and I might be referring you to, like I said, an ENT, but maybe a chiropractor or a physical therapist or a myofunctional therapist, because your tongue just doesn't know where to go. It has room to go into the right place, but it just doesn't know how. So it's like a personal trainer for your for your tongue. And so, yeah, it just depends on, again, that patient's story. And the imaging is really important. Not every, even ENTs don't have the type of technology we have for imaging. The ENT I work with is just loves, because I send all this imaging with my patients, and he can see so much more of what's going on. So
Mhm.
it really helps open your eyes, like, so that you can, look under the hood, so to speak, of the car, of truly knowing what's going on.
Mhm. That's crazy that an ENT doesn't even
I
have
know.
this type of
I
imaging.
actually was shocked as well.
So, one thing I love, and I brought it up in the intro, and it's something that you said during our first conversation together, was normal doesn't always mean good. So, can
Mhm.
you explain by what you mean by that and why so many people may think that their symptoms are just normal life when they could actually be signs of deeper issues?
Yeah, it's something I've said many times over the years, if it's to my kids or my patients or even myself, that, to give an example of not related to what we're talking about right now, I just looked it up. The normal like teenager, what's common is they spend 7 or more hours on their phone right now. And I think most of us can agree that's not a good thing for various reasons. And
Mhm.
so, but that's our normal right now in our society for our teenagers.
Mhm.
But, gently, or, breathing and sleep wise, snoring is very, I get this all the time. Well, yeah, I've always snored, but I feel fine. And I just want people to know that that's their normal, but that's not necessarily good. If you're snoring, you are not getting as much oxygen to your brain as you could be. And like I mentioned before, that can have long-term cognitive effects, heart health effects. If you're
Mhm.
snoring, it's a form of disruptive sleep. You're not getting to the deeper stages of sleep. So, which is what I said, that filters things of our everyday life. And so, snoring might be your normal, but it doesn't mean it's good.
Mhm.
A jaw that pops but has no pain. A lot of people, I bring that up, and they're like, "Yeah, but it doesn't hurt. I've had it for 20 years, or as long as I can remember." And that's their normal, but that's not good. Every time your jaw pops, it's dislocating and pulling on that jaw joint a certain way, and
Mhm.
eventually something will give. And so, a lot of the symptoms I actually mentioned, is they're normal, but it's not necessarily
Mhm.
good. And I had a patient actually I saw a couple weeks ago, and she came in for jaw pain. And like I mentioned, we do a very thorough health history, dental history, sleep, no matter what you come in for. And she had some yeses. And like I mentioned, we dive deep into those yeses. And one was fatigue. And I asked her, tell me more about that. And she just laughed and like shrugged it off. Like, well, of course I have fatigue. I have a 3 and a 6-year old, and, I'm a mom, and just stress, like that's normal. And
Mhm.
I dove a little deeper into other yeses, which she had quite a few. And I was like, this might be normal of what you consider, but it's actually doesn't have to be your normal. And it's not good for it to be your normal. And there's things we can do about it.
Mhm.
Um, and I did go through that imaging with her, and I show the patients, like I mentioned, we go all the way back. And I got to her airway where it shows on the screen like a measurement, and it correlates it with colors. Black and red are highly constricted, small. Blue, greens, and whites are what you want. That's like the big airway and optimal airway. And her color, she really didn't have any. It was like a little tiny bit of red. And she's squinting because it's mostly black, is what her color is. And then she read the number that's right next to it, and she just started crying. And
Mhm.
we just sat with that for a minute, and then she looked at me and is like, "That's why I'm going through all these issues, isn't it?" Like, yeah, that's a big part of it. but there's things we could do. So even though she was crying, I saw this hope in her eyes, and
Mhm.
that she had been to multiple people for this TMJ pain and no one could help her. And it's a high correlation of airway issues for various reasons. But like she was hopeful because everything I was going over, we had a pathway of helping her out, and it was going to help her overall health, not just that TMJ pain.
Mhm.
So that was
Aw.
her normal. And what she thought, well, yeah, I'm a mom with young kids. Of course I don't sleep, or of course I'm tired, or,
Mhm.
so that's a good um, example.
Oh, Dr. Heather, that's so good. And I think a lot of people, it's like light bulb
Yeah.
on, like just understanding all of that. So thank you so much for explaining all of that. And those are some really, really good examples.
Yeah. Yeah, absolutely.
And amazing that you've been able to provide so many people these like answers. And it's,
It's very rewarding too. Yeah.
Mhm,
Because I've
mhm,
been there. I've been there in my own health journey, so to speak.
right.
Yeah. So it's kind of my passion to put a puzzle, like to solve this for them and like be in it with them.
Mhm,
And again, it may not be structural. And
mhm,
because of my nutrition background and different things, I can dive deeper into the stomach health as well.
mhm.
And working with my sister, she has other strengths that help patients with stress and different things as well.
Right. So we're going to be airing Dr. Chrissy's episode a little bit later on.
Okay.
So can you share, like, why did you decide to bring her on and why did you feel like she would complement your practice?
Um, I've always wanted more of a wellness based dental practice. And there's all the things I was learning, there's so much more that's than teeth, that there's just so much more into it. And she had a lot of advanced knowledge. And again, this is all connected. So a chiropractor working on this and the jaw can help in a lot of different ways for my patients.
Mhm,
And so we decided to team up, which is very rare for a dentist and chiropractor to partner up. Um, and in that journey, she actually went and got her training for a myofunctional therapist, which helps me learn as well of how the tongue is plays such an important role with how we breathe and sleep.
mhm,
And so she runs that whole program. And then she learned about infant tongue ties, and she loves working with moms. And when they're struggling with breastfeeding, that's something else. So she made me go get training related to that, which has been very rewarding. And we do that a lot, and that helps so many families. So we're just able to really incorporate what I was saying. Like, we look at someone as a whole and offer more in-house services, so to speak, to help with that.
mhm. Well, Dr. Heather, I'm so glad we've been able to have this conversation and have you on the podcast. For someone who's listening and feels like this conversation has connected a lot of the dots for them, how can people work with you or get in contact with your office?
Yeah, I mean, absolutely. I think the best way is to go to the website at elevateairway.com, because we have a lot more information, knowledge of all of what you may be struggling through, what if it's a jaw issues or sleep issues, or for kids, growth and development issues. And
Mhm,
so we also break it down into what to look for your babies, what to look for small kids, teenagers, adults. And so I think that's very helpful. And we have different social media platforms as well.
mhm,
Um, and we also offer virtual consultations, which has been something fairly new for us, but patients are really liking it because sometimes, I mean, we see people that don't live by us, so that's helpful in general. And sometimes, if it's you or your parent, you just need a little more clarity of, is
mhm,
this something that I want to pursue and dive further and have that thorough evaluation, the imaging, and just kind of, there's a lot I can tell just by symptoms. And so that's been something that people like for sure. And we offer that. And I mean, just something I want to say is, if anything we discuss resonated with anyone, you don't have to push through these symptoms. That there are things that can be done, there are things that can help, and you will feel better, or your child will be better and healthier. And so for you and your loved ones, it's worth diving deeper and trying to start that journey for them.
Dr. Heather, thank you so much for joining us
Yeah,
today and for
absolutely.
sharing your knowledge and passion for helping families and people feel better, understand the connection between airway health, sleep, breathing, and overall wellness. And don't forget that this is a part 1 of a part 2 series. Be sure to tune into our next episode where we continue the conversation with Dr. Chrissy, Heather's sister, and explore how airway health connects to TMJ dysfunction, myofunctional therapy, breathing patterns, and nervous system health. And as always, if you enjoyed this episode, please share it with a friend, leave a review, and subscribe so you don't miss the next episode featuring some of the incredible local professionals that we have here, right here in our community. Thanks again, Dr. Heather.
Absolutely. And thank you, Lauren. I mean, that's so great what you provide to the local community, and I was blessed to be a part of it.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time.